Good morning all. I'm Dr. PJ Madam Rafi. Today we are going to discuss about anti-malarial drugs. Okay. So first of all, before going to discussion, we have to know the life cycle of malaria parasite. Okay. There will be two cycles. One is asexual cycle. Second one is sexual cycle. Asexual cycle will be happen in human body. Sexual cycle happen in the female Anopheles mosquito. Okay. When the female Anopheles mosquito will bite human, it releases sporozoites into the circulation. Okay, when the sporozoites are released into the circulation, it will reach the liver first, where it will mitotic division, then it will be converted to merozoites. Okay, once they mature to merozoites, the liver cell will get ruptured and releases these merozoites into the circulation. They will attack mainly the RBC. Okay, from here it will undergo asexual maturation. Okay, this is asexual cycle. Okay, after that, this they will convert it to trophozoite, then season, then after this seasons will get released into the circulation again, and some of these things will go and bind to the same RBC, and the cycle will be continuous. Second thing will be, they will have some gametes also. Okay, these gametes will be taken up by again into the mosquito when it is binding. Okay, when it bites, obviously these gametes will enter into the mosquito. There how it will be, sexual cycle will be started. Okay, now mainly the symptoms will happening during the erythrocytic cycle. When this erythrocytic cycle will releases these merozoites into the circulation, then only the patient will have symptoms like chills, rigors, high grade fever. All those things will happen in erythrocytic phase. Okay, there will be normally four phases in the life cycle. One is pre-erythrocytic, that means before the erythrocyte RBC, that means from entering of sporozoite to the liver, it is pre-erythrocytic. Okay, next is erythrocytic, that means after that liver rupture, these merozoites will attack RBC. That is next, whatever happening, it is the erythrocytic cycle. Okay, after that gametocyte. Gametocyte means these matured seasons will get released again from the RBC. Okay, so these are gametes, they are releasing from the, after rupturing of RBC, they will release into the circulation. So these are gametocytic cycle. After that one, these gametes will enter into the mosquito. So there will be sexual cycle happening. This is gametocytic stage. Okay, there is one more stage, that is exoerythrocytic stage, that is in between erythrocytic and pre-erythrocytic. Once more is there, that is exoerythrocytic stage. It will be happen in the liver. When these merozoites will be released, some merozoites will be hidden in the liver cell only. Okay, it will be in hypnotic stage, it will be in sleeping stage. So when the patient will have relapse all those conditions, these hypnozoites will have been developed, and it will cause again the symptoms. Okay, this is how normal malaria life cycle will happening. Okay, main thing here will be four cycles. One is pre-erythrocytic stage, erythrocytic stage, gametocytic stage, and exoerythrocytic stage. Okay, there will be different drugs for different stages. So what are those, we will see in the following slide. Okay, so first of all, pre-erythrocytic stage. In pre-erythrocytic stage, we'll have drugs like premarquine, okay, and proguanil. These drugs mainly useful for causal prophylaxis. Means pre-erythrocytic means once it is entering into the circulation to reach the liver. Okay, if you are inhibiting these sporozoites in this stage only, obviously it will act as a prophylaxis. Okay, next is erythrocyte. Erythrocyte means clinical symptoms occurring stage. Once here you are using drugs like quinine, chloroquine, artemisinin. Okay, that is artesunate drugs. So once you are inhibiting erythrocytic stage, obviously it will be useful as a clinical cure, means clinical suppression of clinical symptoms, also suppress prophylaxis. Okay, causal prophylaxis is pre-erythrocytic stage. Erythrocytic is suppressing, means occurring of symptoms we are suppressing before only, that is it is a suppressed prophylaxis. Causing disease prophylaxis will be pre-erythrocytic stage. You have to, these are the MCQs you have to remember. Causal means pre-erythrocytic, suppress means erythrocytic. Suppress means we are suppressing to occurring the symptoms, so it is a suppressed prophylaxis. Okay, next is exoerythrocytic, means it is in the liver. Okay, that is radical cure. Okay, relapse, we have to prevent the relapsing of Occurring means relapse means it is again occurring again. Okay, so radical cure. Relapsing, we have drugs like primaquine. Okay, next is gametocytic stage. Gametocytic stage means prevent of transmission. Here gametes are transmit from human body to female anopheles mosquito body. Okay, so once we are inhibiting the gamete transmission, obviously we are inhibiting the transmission, prevent the transmission. The drug is primaquine. Okay, here MCQs will be causal prophylaxis, suppress prophylaxis, clinical cure, which stage they can ask the stage. Okay, causal prophylaxis means we are inhibiting pre-erythrocytic stage. Suppress prophylaxis means we are inhibiting erythrocytic stage. Okay, radical cure means exoerythrocytic, prevent transmission means gametocytes, and these are the drugs. Okay, in all these drugs the main important drug will be chloroquine. Okay, so chloroquine is having largest volume of distribution. Okay, that means it has a largest volume of distribution, means it will be distributed mainly into the tissues more. Okay, largest volume of distribution. Mechanism action is it prevent polymerization of heme to hemozyme. Okay, that means heme to that means hemoglobin, it will inhibit the hemoglobin metabolism. Okay, that is heme to hemozyme. This hemozyme is toxic. Okay, so there will be accumulation of heme, so obviously this heme is toxic to the parasite, so it will lead to killing of the parasite. Okay, main mechanism action is it will inhibit the hemoglobin metabolism. So when you are inhibiting hemoglobin metabolism, it will lead to cause accumulation of hemoglobin. Okay, this hemoglobin, that means that heme in that hemoglobin molecule is toxic to the parasite, so it will kill the parasite. Okay, so it is a drug of choice for Plasmodium vivax and Plasmodium ovale. Okay, so this is drug of choice for this one, and there will be more. One thing is this, it is mainly useful in malaria and pregnancy conditions. Okay, chloroquine will be most useful in Plasmodium vivax and ovale in pregnancy too also. Okay, is not effective on exoerythrocytic gene. That means it is not effective means in the liver stage, or it is in radical cure. This drug is not useful. Radical cure means mainly useful for primaquine. Primaquine is mainly used in radical cure. Okay. Adverse effect of chloroquine is bullseye maculopathy. Okay, this is an MCQ. Bullseye maculopathy is an MCQ. Next, ECG changes. Obviously, T wave changes will be there. So that's why we have to be very careful when patient is taking chloroquine. We have to be ECG monitoring will be continuous. Okay, we have 24 hours also. We have to do one ECG. We have to repeat one ECG. Okay. Next is peripheral neuropathy. Okay. Last will be skin changes will be lichen-like eruptions, discoloration of nails and mucous membrane. These are the adverse effects. Main thing regarding chloroquine is mechanism action, that is polymerization of heme to hemozyme, which is a toxic metabolite heme. Okay, it will inhibit the heme to hemozyme. There leads to cause accumulation of heme. Heme is a toxic metabolite. It will kill the parasite. Okay. Next is adverse effect, bullseye maculopathy. Okay, these two are very very important in this slide. Okay. Next drug. Next drug is quinine. Okay, quinine mechanism action is similar like chloroquine. That means obviously it is also inhibiting hemoglobin metabolism, that is heme to hemozyme. So when it is inhibiting heme to hemozyme, heme accumulation will be there. That will lead to cause damage of parasite or killing of parasite. That is a toxic metabolite, so it will kill parasite. Okay, it is drug of choice for chloroquine resistant Plasmodium falciparum. Okay, so Plasmodium vivax and ovale, which one is chloroquine? Okay, quinine is it is drug of choice for chloroquine resistant Plasmodium falciparum. Okay, this main thing will be this quinine will cause hypoglycemia. That's why you have to injure. This drug has to be injected along with 5% dextrose. Okay, dextrose injection has to be, infusion has to be along with this. When you are prescribing quinine, it should be administered along with 5% DNS. Okay, dextrose. It is very full safe in pregnancy, mainly first trimester. After second and third trimester, we will use artesunate drugs. Okay. Next, adverse effects of quinine. Okay, mainly synchronism. Okay, what are the synchronism symptoms? Means headache, tinnitus, vertigo, blurred vision. First mainly will be tinnitus. Okay, so quinine will cause, this is that main, you have to remember the drugs names and their adverse effects. Quinine will cause synchronism. Chloroquine is cause bullseye maculopathy. Okay, you have to remember the names. Okay. Next, hemolysis. Hemolysis in G6PD deficiency patients. Okay, these two are very very important adverse effect regarding quinine. Quinine here main thing will be it will cause hypoglycemia and synchronism and hemolysis. Okay. Next drug is mefloquine. Mefloquine we are not using because of its toxicities. It is an effective, but it is the single dose. If your MCQ will be single dose, means these are all drugs we have to give you in multiple doses. But mefloquine, chloroquine, quinine we has to give in multiple doses. Mefloquine is a single dose drug. Okay, that is an MCQ. If they are asking single dose drug, means mefloquine in MCQ purpose only, but practical purpose we won't use mefloquine. Effective as single dose treatment. It is used in both treatment and prophylaxis of Plasmodium falciparum. Okay. Adverse effect mainly cardiac conduction, which means arrhythmias will have chance, then psychosis and seizures because of the serious adverse events. We are not preferring mefloquine. Okay. Mostly we will go with artesunate drugs or quinine. Okay. Next. Next is primaquine. Primaquine is mechanism of action mainly is it forms redox compounds. Okay, it acts as a cellular antioxidant. Okay, there how it will be showing tissue cyanotocidal and gametocidal agent activity. That means it kills all gametes of plasmodium. Okay, and also cyanotocidal. That means it's also useful in radical cure relapsing of malaria. Okay, means cyanotocidal will be hypnosis stage of this one. Okay, plasmodium in the liver. So this primaquine will be beneficial in radical cure also, and it kills all gametes of plasmodium. Okay, main mechanism of action is redox. It will form redox compounds. It will have antioxidant property. They will kill all gametocytes. Okay, adverse mainly these drugs is contraindicated. Primaquine is contraindicated in pregnancy. Okay, next adverse effects of primaquine is methemoglobinemia. Obviously next is hemolysis in G6PD deficiency patients. Okay, quinine also causes hemolysis in G6PD deficiency. Okay, you have to remember the adverse effect. Chloroquine is bullseye maculopathy, quinine is synchronism. Here primaquine is methemoglobinemia. Okay, next is artemisinin derivatives. Artemisinin, coming to the artemisinin derivatives, they have drugs like artemisinin, artesunate, artemether. Okay, these are the most commonly used IV medication in malaria patient. Mostly nowadays we are using artemisinin derivatives only. Okay, it is obtained from Chinese herb. Okay, this is an MCQ. Chinese herb Artemisia annua. Okay, they can ask the drug this one name of the plant also. Okay, artemisinin derivative is Chinese herb. It is a plant is Artemisia annua. Okay, obviously this artemisinin is proton. It converted into dihydroartemisinin. Okay, this mechanism of action is it will generate highly active free radicals. It damages. Okay, that free radicals will damage parasite membrane. There how it will lead to cause death of the parasite. Okay, next is it is fastest acting drug. So you have to give in 2 doses. Okay, that means multiple doses you have to give, and it is useful in all serious conditions. Okay, and drug resistant cases too. Okay, so artemisinin is the most commonly and frequently used drugs in malaria. Okay, if you are having artemisinin, means it is most preferred drug in malaria patients. Okay, mechanism of action is it is generated active free radicals which will damage parasite membrane. There it will lead to cause death of the parasite. Okay, it is used for only treatment purpose, not prophylaxis purpose. Okay, it is not used in prophylaxis. It is only useful for this one treatment purpose. It is a IV medication only used in treatment cases. Okay, in all serious cases, all resistant cases, we can go with artemisinin derivatives like artemisinin, artesunate and artemether. Okay, next. Next is mainly important drugs will be malaria in pregnancy condition. Okay, if it is if malaria is occurring mainly due to Plasmodium vivax, then chloroquine is the drug of choice. Okay, next one is this chloroquine will be continuous till the delivery. Okay, here main thing is malaria in pregnancy we won't use primaquine anymore. Okay, primaquine is contraindicated in pregnancy. If it is infected due to Plasmodium vivax or ovale, we will use chloroquine only. Okay, that is lifelong. That is means till the term. Okay, next if is infected with Plasmodium falciparum or mixed falciparum, first trimester we will go with quinine salt. Okay, second or third trimester we will continue with artesunate combination drugs. Okay, that is ACT, artesunate combination therapies. So this is MCQs regarding in pregnancy. Pregnancy, if it is Plasmodium vivax means chloroquine CQ. Okay, if it is Plasmodium falciparum, quinine. First trimester falciparum quinine only. In second and third trimester we will go with ACT, that is artemisinin combination therapies. Okay, this is regarding malaria. Okay, we have to remember the stages of malaria and drugs, and on pregnancy which condition which drug is preferred. That's all. Thank you.